All right. Well, thanks again for everybody who's joining us today. My name is Jacqueline Sloan. I'm the community educator here at North Kansas City Hospital. I am here to introduce Kodi Watson. She's one of our lovely dietitians here, and she's going to be going over the wellness wheel. So thank you again for joining us, and I'm going to turn it over to Kodi.
Hi. So as she mentioned, I'm Kodi. I'm one of our outpatient dietitians. I'm also a national board certified health and wellness coach. And when I was working in that capacity, the wellness wheel was something I talked about all the time. So I was really excited to get the opportunity to do this class. So there is not a copywritten wellness wheel. So when you see the wellness wheel or you Google it, they vary a tiny bit, but they all get at the same thing of evaluating kind of the 6 dimensions of wellness and kind of your overall well-being and how they're all connected. Why is this not letting me advance my slides? Oh, hold on. There we go. So what is wellness? Wellness is functioning optimally within your current environment. So it is going to change throughout life, depending on what stage you're in. What's realistic given the fact that, you have cancer, you have little kids, you're taking care of a dying parent, there's lots of things that come into play that impact what is realistic for us at any given time. And before we can really focus on wellness, we kind of have to look at Maslow's hierarchy of needs. And you'll see the physiological needs down at the bottom. Sleep is one of them. And studies show that 40% of Americans get less than the recommended amount of sleep. Average for Americans is 6.8 hours, which is down from almost 8 in 1942. And studies show that a lack of sleep can lead to a whole bunch of medical conditions, cognitive impairment. If we get less than 7 hours of sleep, our hunger hormone increases, our satiety hormone decreases. We are insulin resistant for about a day. So it's going to be harder to make those healthy food choices in addition to anything else. So I work with a lot of very seemingly successful individuals who are trying to, become the most that they can be and just reach this peak of wellness, and they're sleeping like 4 hours a night and beating themselves up because they can't get to the gym or they can't lose that last 10 pounds or whatever the case may be. And the sleep is just a huge piece. So we've got to get that foundation in. So 7 to 9 hours is the recommendation for adults. Now, that's a range because some people do really well at 7 hours, and some people that feels like sleep deprivation and they need 8 or 9. So you kind of have to know yourself. So this is a wellness wheel that really kind of gets into describing each of these dimensions. And it's normal for you to put more focus on one area than another at any given time. But our goal is to find a balance that works for you. So I'm not going to read these paragraphs for you in detail, but spiritual wellness is kind of not religion necessarily. It can be, but it's really understanding your values, your ethics that help guide your life. Emotional is having that, emotional health, understanding your emotions, being able to manage stress, being able to ask for help. Intellectual means you're staying curious and you're engaging in learning and you're being creative. You're engaged in your, community. Physical wellness is kind of what you would think. Like, are you moving your body? Are you eating well? Are you sleeping? Are you taking preventive screenings? Are you, just keeping your body healthy and safe? Social wellness is having a strong social network that you can go to for support and guidance. Environmental is taking care of your global environment and your personal surroundings. So is your desk super cluttered? Are you keeping your house clean? Are you, volunteering in your community to keep your larger environment healthy? Financial wellness, this is a huge one we're going to get into. a little bit, but are you taking steps to live within your financial means? You know, this is a big source of stress for people. So we'll get into each one. So this is kind of a worksheet you can Google, and the categories are called a little bit different things on every one, but you kind of color it in or rate yourself 1 to 10 on how well you feel like you're doing on the different areas of wellness. So I'm kind of going through this assessment. As I mentioned, there's variations for the questions in each section, but we're going to go through each one, and you can kind of individually assess how you feel. There is no right or wrong answer. There is no right or wrong wellness wheel. This is only for you, so be honest. And remember, these responses are going to vary based on the life stage that you are in at any given time. So the first one is physical health. So the questions, in the wellness wheel assessment are not really questions, or statements, and then you rate yourself 1 to 10. So I eat a balanced nutritional diet. I exercise at least 3 times a week. I take responsibility for my physical health. I'm generally free from illness. I have annual checkups and specific medical checks as prescribed. And if at all, I'm using tobacco or alcohol as prescribed or responsibly moderately. So when we think about physical health, we're thinking about physical activity, medical care, nutrition, sleep, anything related to your physical body. A lot of people do not get health care because of the cost of it, or because they don't feel like it's important, or they're not dying, so it's not a big deal. But prevention is really important to your overall health long term. So ways to improve that physical health. The biggest thing that I find working with people, I've been a dietitian for 14 years. I've always been in an outpatient capacity for the most part, is finding that gray area. So people as a whole tend to have this very all or nothing mentality. I'm either on a diet or I'm not. Or I ate something that wasn't allowed on my diet, so I've ruined the whole week. I'll just restart on Monday. That's very common thought process, largely rooted in the diet culture in this country. So finding that gray of, okay, well, I'm trying to eat healthy, I'm trying to eat my vegetables, but I had a burger, fries, and shake for dinner. Instead of that ruining your whole week, going, I really enjoyed that burger, fries, and shake. That tasted great. And, tomorrow morning I'll have a veggie omelet and a piece of whole grain toast. Just getting right back on track. It might be taking a 10-minute walk over lunch. It might be getting 10 minutes of sunlight first thing in the morning. That will dramatically improve your nighttime sleep. Getting adequate sleep, eating balanced meals most of the time, and knowing that you're not going to be perfect all the time, and that's okay. And I would love if everyone could share in the chat as we go through, if you have, a great hack or thing that you're doing that helps you, keep any of these areas healthy for yourself. Please share so that everybody walks away with a lot of different ideas of things that they can do. Another one that I do is, unless there's an elevator open as I walk by, I'm going to take the stairs, because I'm in a phase of life where I have little kids and I don't always get a true workout in every day. So I try to, get it where I can. So taking the stairs is an easy way to get that movement in. And I've timed it. It's honestly faster than taking the elevator most of the time. So, that's just another one that can help you get some of that physical health in there. Social health. This is like, can you set boundaries? Are you, having good relationships with your friends and family? Can you resolve conflict? So the assessment questions are, I have at least 3 people with whom I have a close relationship. I can resolve conflicts in all areas of my life. I'm aware of the feelings of others and can respond appropriately. I'm aware and able to set and respect my own boundaries and others' boundaries. I have a sense of belonging to a group or within organizations. I have satisfying social interactions with others. And this, I really like to preface or remind you, this is individualized. So those of you who are Extroverts are, what you consider satisfying social interactions is very different from what the introverts are going to consider satisfying social interactions. So this is where we don't compare ourselves to others. We look at what is satisfying to me. So some actions to improve social wellness, being able to set boundaries. It can help create trust in relationships. It improves your self-esteem. So being able to set those boundaries so that we can act based on the way that we feel, not what we think other people want us to be doing. Making plans with someone. Maybe it's you're satisfied with once a month get together with friends. Maybe you need to eat lunch with someone every day. Joining a group. Social isolation is something that is associated with very negative outcomes, whether you're introverted or extroverted. So the amount of social needs that you have varies, but if you are finding yourself feeling lonely, finding yourself not having those social relationships, joining a group. There's groups for everything out there now. So that's a great way to meet people. Doing things that decrease your stress and increase your joy, joining an exercise class, always to kind of improve that social wellness. Financial or occupational health. This is a big one, as I mentioned, that really impacts a lot of the other areas. So 70% of people say that financial stress is their biggest source of stress. 48% of people report stress when dealing with finances. 60% of households don't have 3-month savings on hand. Your IQ drops when you're preoccupied with money problems. 1 in 5 people don't seek medical care due to financial concerns. And 1 in 3 people in partnerships report money is the biggest source of conflict in their relationship. So you can see how if you are really out of balance here, it's going to impact your physical health. It's going to impact your social health. It's going to impact your emotional health. It really plays a big role in a lot of areas. So the assessment questions are: I live within my means and take financial responsibility for my financial decisions. My spending and saving habits reflect my values and beliefs. I actively plan for periods in my life when I may not have income. I pay bills on time and positively manage credit. What I am doing with work or school has purpose, and I have similar financial beliefs and practices as those with whom I am close. So some ways to improve that financial or occupational wellness, making a budget. Most of us were not taught how to do this. So there are, a lot of resources out there to help. If you have an EAP, they usually have financial counselors as well. Seek guidance, whether that's financial planning guidance or if that's, maybe a mentor at work to help you, navigate your career. Separate work from home. A lot of people that I work with will work 10, 12 plus hours a day because they feel like that's what they need to do to be successful. Your job's never going to love you back as much as you love it most of the time. So really kind of having those boundaries of I'm doing a fantastic job when I'm at work, but when I'm at home, I'm focusing on my family, my friends, my physical health. We can't just, do nothing but work all day. Some of these tips, really depend on the life stage. Taking a mental health day is great if you are struggling with kind of your occupational wellness, but if you don't have the PTO and you can't afford to take a day off, that might not be an option for you. Asking for feedback at work can help you kind of know, are you doing a good job? Are you stressed about something that maybe is not as big of a deal as you think it is? Or maybe there's areas that you're not even aware of that could help you do a better job to maybe make more money or whatever the case may be. So asking for help is definitely helpful. Intellectual health. 51% of people report being satisfied with their overall job. That is not a lot of people. It's barely the majority. 23% of adults have not read a book in the past year. The other things around intellectual health are, can you critically think and consider an opposing view? Are you open to new experiences and ideas? So the statements to assess the intellectual health are, I have specific intellectual goals, such as learning a new skill, a specific major, etc. I pursue mentally stimulating interests or hobbies. I'm generally satisfied with my profession or major. I have positive thoughts. I would describe myself as a lifelong learner. I commit time and energy to professional and self-development. Some ways to improve intellectual health. Join a book club. Research topics of interest each month. Get involved in a local group of some sort, whether it's a social group, educational group, political group. Keep a journal. Do logic puzzles or games regularly. Emotional health. The assessment questions are, I have a sense of fun and laughter. I'm able to feel and label my feelings. I express my feelings appropriately. I have a sense of control in my life and I'm able to adapt to change. I am able to comfort or console myself when I am troubled, and others would describe me as emotionally stable. So some statistics to consider here. 15% of adults had a substance abuse disorder in the last year, and 93.5% of them did not receive any treatment. 23% of adults reporting 14 or more mentally unhealthy days in the last month could not see a doctor due to cost. 19.1% of adults have an anxiety disorder, and 11% of physician office visits have depression listed in the medical record. So there's a huge portion of us that are maybe not thriving in the emotional health area. So some ways to improve emotional health are to acknowledge your feelings. I wouldn't want to say a lot. I would say most of us were not raised with any emotional education or words for emotions. Mad, sad, happy, that was kind of it. And I have a resource at the end on a book that kind of goes through all the different emotions and what they mean and how they feel and ways to cope with them. So really kind of getting curious and acknowledging those feelings. Meditation, yoga, mindfulness, all great. There was a study on thousands of nurses. I didn't cite it here. I just remembered it right now, but it was a large chunk. I don't know the exact number, but they were able to reduce baseline stress by a third when they just meditated for 10 minutes a day for 2 weeks. So it's kind of a cumulative thing. The more you do it, the greater benefits that you get. And I have a resource for mindfulness, meditation, and yoga at the end as well. Realistic expectations and boundary setting are great for our emotional health. Reaching out to friends or family when we're feeling down or isolated. Spiritual health. As I mentioned before, it does not have to mean religion, though it can. It's opportunities for us to engage in a force greater than ourselves. It's engaging in our communities. It's beliefs, values, and ethics that guide us through our life and inform our actions. So the spiritual health assessment is, I practice meditation, pray, or engage in some type of growth practice. I have a general sense of serenity. I have faith in a higher power. I have a sense of meaning and purpose in my life. I trust others and I'm able to forgive others and myself and let go. Principles, ethics, morals provide guides for my life. So some ways to improve our spiritual health are to practice meditation, to spend time in nature, to connect with a faith community. I've spent time in nature twice. That's great. Another one might be yoga. It might be, getting involved in, some kind of volunteering capacity where you're helping others. So, how do you feel about your wellness wheels balance? And remember, there's no right or wrong answer. There's no right or wrong wellness wheel. This is going to change based on your life stage. So think about what area had the most, you're supposed to use colors to fill that in, but what area do you feel like you were doing the best in? And which area do you feel like you were doing not as well in? And why did it not? Oh, So as a result of doing this wellness wheel, think about how you can improve your life balance. Like, what might your first step be? So an example might be, oh, I was really not doing anything for my emotional health. So I'm going to start meditating for 3 minutes a day. Or I'm not doing well in my physical health. I'm going to start taking the stairs. It can be small, it can be huge, whatever you think is realistic. So then kind of think about like, okay, I'm going to review these results on a certain day and I'm going to redo this activity and see, how have I improved? So some activities that kind of span several dimensions are things like yoga, walking or exercise, time in nature, volunteering, time with friends, joining a group. Those things can all impact multiple different dimensions. I could do a whole class on behavior change, but start with one small thing. You do not need to overhaul your life overnight. That's not been shown to be successful. That's why when people sign up for these like diet programs, they do really well for a few weeks and then fall off. So one thing to work on, and then when that feels like a habit, add something else to it. So you could try a habit tracker or a journal. That is very successful for many people. Getting someone else involved in your goal is often helpful. There's a book that I'm going to show you in a couple slides called The Four Tendencies, and there's a quiz, kind of how do you meet expectations? And a large percentage of us are described as being upholders. So you really do well meeting the expectations of other people, but you might struggle to meet your own expectations. So the hack for those folks is to get someone else involved, whether that's you get a dietitian or a health coach or a therapist or a financial advisor or whatever. Maybe you make plans to walk with a friend every morning. Maybe it's you pay for an exercise class and you know that instructor is going to be looking for you. Just having someone else involved can provide that accountability. So seeking that support, however that might look, depending on what dimension you're working on. So some resources, Talkspace has had a great blog on the wellness wheel. Headspace has quite a few articles that are for free. They're an app it's a meditation app, and it's great for people who have maybe never meditated before because it teaches you how to do it. They have courses on a lot of different, topics in life. They have some yoga videos. I'm a big fan of their 5-minute walking meditation. I'll just kind of go outside and walk for 5 minutes and listen to it sometimes. Calm is another meditation app that people really like. WebMD, this link goes to their 7-minute workout. So a lot of people who are like new to exercise, not sure what to do, or just like don't have time to do a full workout. This is a clinically proven circuit that you can do in 7 minutes. A lot of people really like that as kind of a way to just get started. North Kansas City Hospital outpatient dietitian team, we are happy to help you. You just have to have a referral, so ask your doctor and they can fax that over. These are a few more resources. Looks a little cluttery, but I wanted to give you pictures of things. So Brene Brown, if you're not familiar with her work, she has a ton of books. She had a podcast. She has a special on HBO Max, if you have that, on Atlas of the Heart, which is her book all about emotions. So she's a social worker, but she has a doctorate. She researches stress and emotions and kind of all those areas. So she's a great resource. But this book specifically gives you the language to describe your feelings, which when you grew up with mad, sad, happy, you realize there's lots of emotions behind all of those. And she goes into all of that. Burnout, the secret to unlocking the stress cycle, is fantastic. For people who are just chronically stressed, it really kind of helps break that down for you. North Kansas City Hospital has a bunch of fitness classes that you can sign up for like 6 weeks that are great. Netflix did a special, Headspace did a special for Netflix all about, what is meditation? How do you meditate? Gives you some ideas. So if you have Netflix, you could check that out. Yoga with Adriene is a free YouTube channel that has tons of yoga videos for beginners. Some of them are 10 minutes, some of them are 20 minutes, some of them are an hour. She's got a great bedtime yoga sequence. The 4 tendencies that I mentioned, kind of how you meet expectations can help with behavior change. And the Nike Training Club app there's a free component and a paid component. You don't have to do the paid component, but it's nice for people who maybe are a little bit familiar with exercise, but don't have time to go to a gym, can't afford to go to a gym. There's lots of free workouts in there. Some of them don't require any equipment. So that's nice kind of, and they're short. Some of them are short too. So that's great for those busy folks who don't have time to do a full long workout. So are there any questions? I would love to answer any questions people might have. I don't know how to get back to the question section. So Jacqueline, please feel free to help me out there. Oh, here we go. Q&A. Oh, no questions in the Q&A. Okay.
Yeah. Kodi, that was wonderful. Thank you for all that information, and especially those resources. I've actually done the yoga with is it Adriene? Yeah, and it's really a great source just for something quick and easy, and especially when you're trying to incorporate more meditation and just more mindful practices. So thank you so much for sharing that. And to our attendees, I just want to let everybody know that this is a recorded webinar, so you can find it on the North Kansas City Hospital and Meritas Health's YouTube channel. So feel free to access this webinar at any time. And just want to thank everybody for joining Kodi and I today. Kodi, thank you especially.
Thank you.
Nice to hear from the professionals. So. And if anybody has any questions, feel free to reach out to either the Community Health and Wellness department for information on classes or continued education, and feel free to reach out to our team of dietitians here.